Professor Rita Formisano at the Foundation Santa Lucia, Rome, on neuro-rehabilitation through music, brackets, efficacy of music therapy.
My topic will go on neurorehabilitation through music, and Santa Lucia Foundation. Okay, thank you. This is Santa Lucia Foundation, where at the second floor there is my post-coma unit, where we admit patients directly from intensive care units and neurosurgery wards. And here is our gym and our swimming pool and two-bed room. These are some samples of cases during recovery of consciousness where patients had to run with not only with the neuromotor rehabilitation project, but also with a neuropsychological rehabilitation program. Music therapy, as all of you know, may be differentiated in passive or receptive music therapy, defined as musical hearing of pre-recorded or in vivo played music, or active music therapy based on a musical dialogue between the music therapist and the patient, based on the improvisation, execution, and production of sounds. This is one of my most comatose patients during the music therapy sessions, and Nordoff and Robbins first reported the possibility to engage post-comatose patients or comatose patients in active improvised music therapy, which is defined as a musical improvisation between the music therapist and the patient, by means in the acute phase by singing in order also to regulate the vital functions, as you will see in the next slides and in some videos, and also by using different musical instruments to modulate not only the vital functions but according to the neurological conditions and the residual abilities of the patients. So we published some years ago our first experience in post-comatose patients by means of active improvised music therapy, because in our patients generally you may have a deficit of collaboration, and this approach, the music therapeutic approach, may show much more collaboration than in the routine standard rehabilitation, such as physical therapy, including physical therapy, occupational therapy, cognitive and speech therapy. Of course, the music therapeutic approach was an additional treatment of our rehabilitation project, and we utilized not only the standardized disability scales, but also the semi-quantitative scale, which was judged by a blind observer of video recordings of the music therapeutic sessions by means of the judgment of this blind observer of not only psychomotor initiation but also some other behavioral disorders during coma recovery, including agitation and responsiveness. This is one of our cases during recovery of consciousness, and you see here this lack of psychomotor initiation, and this we call this behavioral disorder as inertia. Or we may also have some oppositive behaviors or agitation or aggressive behavior, such in this case. And our individual music therapy approach showed significant improvement of the collaboration and the reduction of these undesired behaviors, such as inertia and agitation particularly, and also an improvement of of responsiveness. And we also had a trial with a group music therapy, especially in minimally conscious state patients, and we involved also the caregivers in the group. And now please enjoy this video. I don't know how to start with the video, but anyway, my supporter will help me. And I only give you some comments, but I prefer that you enjoy the video and I see it together with you.
Absolutely.
This is a patient, a post-comatose patient, particularly not cooperative, as you see in the first sessions, in the first music therapeutic session. She had a severe traumatic brain injury during car accident. And the music therapist is trying to engage the patient in this musical dialogue. At the beginning, without any success, as you see. You don't need any musical experience. The music therapist is only trying to attract the interest in a different dialogue by means of music. The mimic expression is changing, as you see. She's much more interested now. She smiles for the first time. She was very aggressive during physical therapy and the tentative of cognitive therapy. This was the first time she smiled. And this is the modulation of vital functions by means of singing of the music therapist. It's a vegetative state patient. After a severe motorcycle accident. Before he was a football player, soccer player. And this was the first sign of interaction with the environment. As you see, he turned his head toward the music sound. The evolution of the patient was toward a minimally conscious state with a minimal interaction with the environment. it was interactive only during music therapy session. And this is a group music therapy approach. These are patients in different phases of recovery of consciousness. Now you see also some examples of patients in the first phases of emergence from minimally conscious state. Of course, this musical dialogue should be according to the neurological abilities, residual neurological abilities of the patient. Okay, in order to let time to the other speakers, in conclusion, in the acute and post-acute phase, the music therapist may modulate vital functions by singing in a comatose or disturbed state patients or minimally conscious patients, and individual and group music therapy in post-comatose person may improve initiation in patients with psychomotor inertia and may also reduce agitation and positive behaviors in uncooperative cases. Thank you for your kind attention.